Hamzat Lawal is standing by. He's the Chief Executive Officer at Code. Earlier on, I did talk about the donations that we've seen are so far coming in from banks as well as wealthy individuals. The donations are still coming in, even some not just money. Some are also giving some kind of relief materials. Hamzat, I can see you. Good morning to you. Welcome to April. I also know today is April Fool, so no one is even thinking of April Fool today. Welcome to April. Welcome to the second quarter. How are you, Hamzat? Hamzat, can you hear me? Apparently, it seems Hamzat can't hear me.
I can hear you now.
Okay.
Good morning, Nancy.
Good
morning, Nigerians.
Good morning. I was actually saying welcome to April. This is the first day of April, April Fool's Day. No one is doing April Fool's today because COVID-19 is enough April Fool for all of us in the world, so to speak. So welcome to the program. Hamzat, I don't know if you saw a video we played earlier of a woman that Ebuka met yesterday at Karu Market. While this program was on, she actually did say she didn't have money to go back home to feed her children, to even buy a mudu of gari. She doesn't have the money because it has increased. Speak to me about what you think this lockdown, which is necessary to fight this pandemic, and what is also going along with it in terms of suffering, hunger, and poverty.
Well, thank you so much, Nancy. While we understand that this lockdown is important so that we can curb the spread of COVID-19, I believe that government has failed to provide palliative measures. Because right now, when you even give people money, that money has no value. There's increase in inflation, cost of household item and food item have gone up. And right now, you can't even go to the market because some of those markets have been closed just so that people adhere to social distance. So it's quite sad and unfortunate. I saw the video yesterday that you played, and I cringed, and I was like, this is an opportunity for government to support particularly the poorest of the poor. I'm aware that social intervention using the NASCO data from over 2 million households where they've registered over 11 million people, they hope to provide palliative for these people. But how did you come about this data? Mind you, Nigeria is the poverty capital of the world, which means that over 80 million people live below 360 naira. Now the dollar is over 400 naira. But with COVID-19, what this would tell you, and if you look at the data, over 100 million people as of today would be very poor because people cannot even go and fend for themselves. Mind you, some people live daily, so they survive on their daily income. They're not covered under any salary scheme. So what this tells you is a lot of people would suffer, a lot of people, will go to bed hungry, and a lot of people will not be able to provide for their families. And this also shows some lack of proper coordination, lack of information and transparency. And talking about transparency, Nancy, the past days we've seen government, private individual and private institution have come forward and donated billions of naira. So far, the money that we have independently mapped put this figure to over 40 billion. But Nigeria is lacking a comprehensive digital transparency and accountability database or website where you can find expenditures, which includes revenue, deficit, or debt. The Ministry of Finance presently is failing to make public details of COVID-19 donation. Mind you, the president in his speech said that, he has already inaugurated a task force that is headed by Boss Mustafa, who is the secretary of the federal government. And Boss now giving to Minister of Finance to coordinate mobilizing of these resources. We know that also the Ministry of Humanitarian Affairs have said that they're going to provide support to the poorest of the poor using the social investment structure, so providing a school feeding program. Knowing that schools have been shut down due to coronavirus, they're going to go to household and they promise to adhere to the social distance. But then again, we as Follow the Money champions cannot effectively track these donations or relief or those funds when we can't even issue a freedom of information request. I'm aware that some of your colleagues, some journalists are really frustrated because they're asking salient questions on how much have been donated so far. And, it's quite unfortunate and it's really sad. If you follow a statement issued recently by Pastor Paul Eneche, he's now a victim of fake news, because it was documented that he has provided relief in tune of 2 billion. And because he is a religious leader and he does not want to claim what he has not done, has come publicly and said, yes, I provided relief to a primary healthcare center, but it is not in tune of 2 billion. When government is not properly coordinating and publishing this information or statistics, then mischief makers will cash on this and misinform the people. For us, we want to be able to ensure that we provide public trust, bring people closer to the government, and ensure that government is able to respond effectively. After COVID-19, we would ensure that we do a social audit. But for you to do social audit, you have to get data. The president, Boss Mustafa, has compelled the Ministry of Finance. And this is simple. Open an Excel sheet. How much have been accessed, how much contributed, how much have been disbursed, and to whom, so that we can effectively track. And let me be specific. One of the bank gave FCT administration 500 million. And we made a call on Twitter. We tweeted, Follow the Money tweeted at the FCTA official handle and said, how do you intend to utilize these resources? We got a response saying they were going to give 200 million, to NCDC. And then they kept mute on the 300 million. So again, this time is begging for greater transparency. As much as we are working with government and joining the citizens to ensure we stay at home, we adhere to social distances and wash our hands with soap. But then what is important is broader transparency and accountability. The private sector and private individual are even leading that in being accountable and transparent by making public their donation. I'm aware that Dangote is leading the Nigerian Private Sector Coalition against COVID-19, and they've created a dedicated bank account with the CBN. But that's not enough, because government needs to be able to coordinate, provide public knowledge and information.
Okay.
Nancy, if you go to the US government website or the UK government website, you would see how much the government have mobilized, how much they've released, and who they've released these resources.
Yeah, okay. Hamzat, since you've just said the US now, let me take it from there. Let me take my next question from there, which is what we've seen, at least in the Western economies, Western world, where they are also fighting COVID-19 pandemic. You mentioned the US. We've seen over $2 trillion by the US government. We didn't see like fraction, Bill Gates giving this and this. I'm talking now about a holistic approach. How holistic do you want that approach to be? You just mentioned earlier that Aliko Dangote is coordinating private sector coalition against COVID. I'm aware that I think that PwC, PricewaterhouseCoopers, will coordinate that, because, when it comes to private sector, perhaps transparency, it's a bit better than what government is doing. So what kind of holistic approach are you expecting for us to be able to track and follow the money to where the money is needed?
Nancy, what government has to do is, make public how much they've mobilized, how much they've released, and even let us on who are this body who are coordinated from, if members are part of government institution, private sector driven institution. What palliative are they providing? Because you can't say that you're going to use the social investment structure. What about people that are not captured under the social investment structure, like the woman we watched her clip yesterday? You're saying that people should stay at home too, which is standard. But how are you also providing support for these people who are staying at home? So, for instance, also, how is government also interfacing with private sector, particularly the communications industry? So we know that internet access is very expensive and the network are terrible. How are you ensuring that you negotiate with them so that they can cut the cost that citizens are paying for service delivery and improve this service? So, thank God that NEC has come up and say, we're going to halt, the increment of paying a bill. This government needs to holistically coordinate all of this in a way. The private sector can only do little. Government is saddled with that responsibility to build public trust, to provide timely information, and of course, continue that engagement. So, for instance, today, even NCDC, as much as we're supporting them, and I commend them because they're on the front line of this pandemic, how many tests have been conducted so far? If you're lacking, what exactly are you lacking and how can government respond? I know government have released about 6 billion to NCDC, but we need also information on how these resources are going to be utilized. I know that there's no time to follow through with procurement laws or policies, but as much as we procure some of these relief materials and healthcare equipment, we need to also ensure due diligence. We need to ensure cost effectiveness, to provide broader service delivery and ensure that communities and citizens at the grassroots get this palliative. Nancy, I need to state it clearly that if COVID-19 finds her way to grassroots communities, will deep problem. If this spread.
Okay, to the program. Hamzat is still with us. Hamzat is the Chief Executive Officer at Code. Hamzat, let's talk about the conditional cash transfer, which is 5,000 naira, which the federal government gives to the most vulnerable in our society. It's been also argued that who are those collecting that 5,000 naira? There is also, of course, the school feeding program, which the president alluded to, but he's also been criticized that how can you say school feeding at this time when schools are closed? There's the issue of trader money, market money. From the video that we even played, or from the woman that we met yesterday at the marketplace, for that kind of woman, you will see that 5,000 naira or even 10,000 naira will go a long way to alleviate her suffering, as at yesterday. How do you think that government can move ahead in terms of putting palliatives together? Also, in line with that question, the B part of the question is what we're seeing in Lagos so far. The governor of Lagos State, Babajide Sanwo-Olu, has come up to say Lagosians, residents, or Lagosians would enjoy at least some part of palliatives, giving food. I think I saw something going on social media yesterday. Some people received rice, some people received bread and all of that. But is it really done well, especially as Nigerians are fighting the pandemic? Because we are fighting the pandemic, we're also trying to fight hunger, we're trying to fight poverty, because we are the world's poverty capital. So it has to go hand in hand.
Yes, so taking it from the school feeding program, of course, we know that it's important because if you look at the statistics, millions of children in Nigeria are malnourished. And we've seen that the school feeding program have actually increased enrollment in schools. I particularly have understudied this program, and I've joined some of my colleagues to go to some states across the federation that this program is being implemented. Even the conditional cash transfer to poor people. I remember my time in Anambra State where I engaged a 70-year-old woman who had diabetes, and this money is also the money that keeps her going so she can procure food and her drugs. But we need to look beyond, the social investment and palliative provided, by the government. I think the federal government needs to go and take a cue from Kaduna State. So yesterday, Kaduna State Minister of Health came public and said the governor has approved 500 million, and for years they've been putting in place food bank, and now they're opening their food bank and they'll distribute this food to households and poor people in Kaduna State. This is how you engage using social media. This COVID-19 has shown that Twitter and social media platform is an effective instrument of governance and building public trust. And coming to your second question, Nancy, see, right now, they're going to do a lot of procurement, because COVID-19 has shown that government would have to turn to emergency procurement, especially in expenditure and negotiating contracts. What's important is to put in place a law that looks at digitizing. I think COVID-19 has shown that it has showed an opportunity where government needs to digitize and provide timely information. Because if you look at what we need, for instance, in terms of medical supplies, we're talking about ventilators, we're talking about personal protective equipment, test kits and whatnot. I'm going to ensure that government publish tenders, which would be advertised and bidded, competitively, and this contract signed, in a timely manner. So again, there are opportunities, but most importantly, Nancy, if COVID-19 find her way to the grassroots, I'm not sure if you got it the last time, we're going to be in deep problem, because today our primary healthcare center, what this COVID-19 also shows is the lack of the fact that there is no proper investment in the healthcare sector, and COVID-19 has now brought all of us equal, be it, in the upper class, middle class, or be the poor, this virus affects equally. So again, what this is also telling us is there are opportunities post-COVID-19. Even if Follow the Money is going to ensure social audit, how is government going to invest and ensure that primary health care facilities are properly equipped, and we have the manpower to ensure that Nigerians don't have to always pay out of pocket and not get better facilities.
Thank you very much, Hamzat. I think we'll just leave it at that. Let's continue to watch the situation. It's for us to continue to advocate, like we do regularly on this program, for us to continue to point out perhaps where government is, should do better. And let's see what happens from now in the days ahead. But we'll continue to monitor. We'll continue to track the funds. We'll continue to follow the money. Like I said yesterday on the program, how many testing kits do we have, for example? Apart from the one that Jack Ma donated to Nigeria, which I know they are using right now, are we purchasing the testing kits? How much are they worth? How much does the test go for? For example, how much hazard allowance is being paid to those at the front lines, the healthcare workers? These are questions that we really need the authorities to answer. But thank you very much, Hamzat, for speaking with me.
Thank you, Nancy. And those of you who are at home, you can join us in following the money at ifollowthemoney.org. Now more than ever before, Nigeria needs to be more transparent and accountable so we can tackle fake news and also ensure that public money works for public good.
All right. Thank you very much, Hamzat. I wish you a good stay at home for the next 2 weeks at least. All right. Just before we go to the next segment, because today is Wednesday, as the CBN Weekly segment on this program, but of course still in line with the pandemic, coronavirus, which we're fighting in Nigeria, I will be bringing to you in a bit what the governor of the central bank did say concerning the private sector coalition against COVID-19. In case you missed that, we're bringing it back to you. But just before we go to that, let's take a few comments coming in. I'm seeing a lot of comments on Twitter right now concerning what we're doing now. And let me just take a few of them. The cashless policy of the central bank takes effect nationwide from yesterday, yes, March 31. We need to get updates, Nancy, and how it affects the activities of other financial institutions who bank with commercial banks. Do we expect any changes under COVID-19? You will get that update. It started yesterday, of course, for Lagos, Abuja, and some other major cities across the country. Started cashless policy quite a while ago, but it was announced that from March 31, at least from today, other parts of the country it will take effect. Perhaps it's because of COVID-19 pandemic. People are not even talking about that. Even the central bank is not is busy chasing the fight right now against COVID. Chibuzo Onujiogu says, "Good morning, Nancy. Good morning to you. You are doing well on this morning show. Thank you. All the billions contributed to donate to the fight against COVID. Hope it will be spent judiciously. The government needs to go all out to give food and money to the people in need and not channel it to their accounts." Okay, that's why we're doing this. We're tracking and following the money. Honorua says, this is merely a reduction in figures. It's not a reflection of the economic situation, international economy and current fundamentals. This government must take citizens' welfare seriously. Whatever doesn't reduce prices isn't working. Okay, Abdul Ghani says, hope the fall of fuel is being done with NLC and other relevant stakeholders to achieve the desired deregulation objectives. That's another issue for another day. Why shouldn't we deregulate that sector? Okay, Akachuku says, everybody is affected by the increase in the price of food products as a result of the lockdown and stay-at-home order. While Chibuzo is saying, hi Nancy, what's the government doing with all the billions donated for COVID-19? There is poverty in Nigeria. People need money and food. The government has failed to their responsibilities. Ame just says, God help us. Many comments coming in. Ekpe says, poor and uncoordinated implementation of the fight against COVID-19 by the federal government will create more misery for the masses, but businesses for the politicians, security agencies, and scammers. Wow. Atta Joseph says, creating a means of survival for many households would have helped many, not flaunting the orders given by the president. Food is a necessity, and without it, many would do a lot of disrespectful acts. So many. I see your comments coming through. Please, let's keep that conversation going on. You can check us all out on our social media handles. On Twitter, I am Nancy. On Facebook, we are Moneyline with Nancy. On Instagram, we are _Moneyline with Nancy. Which other social media account I said? You will be seeing those addresses on the screen. And on YouTube, go check us out on YouTube. You get to watch this program on YouTube and other programs, Moneyline with Nancy on YouTube. And don't forget, when you are there, it only takes 2 seconds for you to subscribe, 2 seconds for you to click that button. Let's quickly take